Okay, Mark. You put me downhill. Thanks, everyone. Good to go?
Yes.
Okay, well, good morning, Queensland. Can I say how wonderful it is to be here at the Doomben Racecourse with Tony Partridge, the Chief Executive Officer of Brisbane Racing Club, and also, of course, Dr. Jeanette Young, Chief Health Officer here in Queensland, at the site of one of our new community vaccination hubs. We opened yesterday, and it is wonderful to see we had over 200 people vaccinated here on site yesterday, and we expect a lot more as we go forward. This site will be open over the weekend, so if you live nearby, you are welcome to jump online. We'd still prefer bookings because, as I've already seen this morning, if you've got a booking, you're going straight in, but if you are walk-in, you may have to wait. So to avoid that wait, please make a booking, jump online, have a look at what community hubs are available in your local area, not just today and tomorrow, but also over the weekend. I want to thank Tony and his amazing team working with us to set this site up so quickly. And I've heard the great news is that this will still operate even when the racing is on. So let's be clear, if you're popping down to the races this weekend, why not get a jab at the same time? Get vaccinated for COVID. What a great way to finish the weekend off. So as far as our update on COVID, I can advise that there's 8 new cases in the last 24 hours. 6 of those are overseas acquired and in hotel quarantine. One of those cases is the woman that we notified yesterday afternoon, the 44-year-old woman, and the second case is now a confirmed positive case, her husband, who also travelled from Victoria with her. They are both now in quarantine, as Dr. Young said yesterday. We now have 18 active cases in Queensland. We had 9,857 tests yesterday, so thank you to everyone who's coming out and getting tested. And wonderful news, 11,827 vaccinations yesterday. Again, a record number of vaccinations. And I can advise that today we will hit 1 million vaccination doses being administered in Queensland. 1 million. So I want to thank our GPs, the Commonwealth vaccination centres, and of course all of our Queensland Health public vaccination sites that have got us to this point, 1 million doses already. So that is great news, and that number's just going to continue to grow as we go forward in days and weeks and coming months as we get more vaccine available to us. Just in relation to the Sunshine Coast, Dr. Young will give a more detailed update, but the good news is that it appears that both the 2 individuals are at the end of their infectious period, which means the risk is lower than we were expecting yesterday, which is really positive news. But we are saying to people, please have a look at the exposure sites. If you've been to an exposure site, you need to get tested and quarantine and wait for advice from Queensland Health. So you need to register online with the contact tracing form, and Q Health will contact you and advise you how long you need to be in quarantine for. And also, we are not locking down any of our vulnerable sites, being hospitals, residential aged care, residential disabilities. However, if you have been to an exposure site, you cannot access any of those particular high-risk sites over the next 14 days. So that's the only limitation we're putting on in relation to those sites. I can advise we have testing clinics operational, particularly in Caloundra. We have the Caloundra Specialist Ambulatory Care site. That is, the entrance is adjacent to the Minor Injury and Illness Clinic. That is open from 8 a.m. to 8 p.m. and it will be open over the weekend. It's a drive-through site. You can walk in as well. Please register, because there'll be 2 lines for those cars, the registered and the non-registered. So if you want to get in and out quickly, you are best to register and drive into that clinic. There's also the Nambour General Hospital and the Gympie General Hospital that are doing testing, and there are many, many private pathologists available to do testing as well. As far as vaccinations, we want people to keep coming out over the weekend. The Sunshine Coast University Hospital's bookings are very full over the next couple of days, but there is the Nambour Vaccination Centre that still has bookings available. So if you are in the area, you can go to Nambour and book in. But also there are 77 GPs in the area, and there's also 2 Commonwealth clinics that will be getting additional AstraZeneca, that if you are 50 plus, you can book in with them to get your vaccination. We want everyone to getting vaccinated as quickly as possible, and we encourage you to take up that option. I'll now pass to Dr. Young, and then we'll hear from Tony from Brisbane Racing Club, and we'll take questions. Dr. Young.
Thank you very much, Minister. So yes, some good news. We had those 2 confirmed cases related to the woman and her husband who travelled from Victoria. So yesterday that first lady was announced as a confirmed case. Her husband tested negative, but he's now tested positive. And we know that often happens towards the end of someone's illness. And I've now had confirmation from serology testing results that both of these individuals are towards the end of their illness, which is very good news for Queensland, and that means the risk of transmission to anyone else is less. It's still there, and I still need everyone to come forward who develops any symptoms at all, who lives in the Sunshine Coast or Goondiwindi or Toowoomba. It's very, very important. And anyone who's been to any of those many venue sites, it's vital that they come forward. And more than 400 people already have, which is excellent. And we've seen a lot of testing already started. That needs to continue, just so we can make sure that there hasn't been any transmission out there. Of the 17 immediate close contacts that we've so far identified, 3 have tested negative already. We've got those results, and 2 of those are the parents who they were staying with. So they were staying in a household in Caloundra, the lady, her husband and some parents, and they've tested negative, which is very reassuring, but we need to continue all of that testing. Because I believe this risk is actually a little bit lower, I haven't asked all of our vulnerable facilities to go into lockdown at this stage. So you would know and be aware that usually when we have an outbreak, I require hospital, aged care facilities, disability care accommodation facilities and prisons, if there are any in that locality, to go into lockdown. I don't believe the risk is such that we need to do that for this particular outbreak at this stage, but of course anyone who's been to any of the venues, or indeed anyone who's unwell, shouldn't visit any of those facilities for 14 days since they were at that venue at the time that one of these 2 individuals from Melbourne attended those venues. So all of those venues are listed on our website. And I'm grateful to the assistance that the 2 individuals have given us in going through so carefully with us where they have been in Queensland since they arrived. So we have all of that information. It's very, very important, please, for people to check it. Then the other thing that everyone should consider, but particularly those people in the Sunshine Coast, is that we do have vaccines available. So anyone who's 50 years of age or over, please go and visit your GP or one of the Commonwealth vaccination clinics and get vaccinated. There is plenty of AstraZeneca vaccine available through the state, and the Commonwealth has doubled the numbers of vaccine doses for GPs in the Sunshine Coast area. So please go and get vaccinated. Go online and check where there are appointments and get vaccinated. For people under 50, here at Doomben, which has been open today, which is just fantastic to see, and all of our other community sites. Please go and attend those, particularly if you're aged 40 through to 49 or in the 1A or 1B category. It's really important that you avail yourself of the vaccine. Once we've got some spare capacity, we'll be reducing that age cut-off below 40. But at the moment, a lot of our sites are filling up, so I still want to give another chance for that 1A and 1B group to finalise vaccination. That's all our aged care workers, disability care workers, frontline health care workers, emergency services, and those people who are vulnerable. It's really important they get done, and the 40 to 49, and then we'll open up as soon as we can to lower age groups. So please keep alert to when we open up to those lower age groups. Thank you.
Thank you, Minister. The Brisbane Racing Club looks forward to playing its role in this vaccination rollout. We're very happy that Queensland Health so quickly put this community vaccine hub together at Doomben. It's a very convenient site. There's ample parking. Just follow the sign straight up into the grandstand. And if it's a race day, of course, you can stay for the races. We race here roughly once every week, but we didn't blink to say yes to this opportunity to help. So on behalf of the Brisbane Racing Club, congratulations to Queensland Health for putting it together so quickly. Thank you.
Minister, can I ask, what's the stage of the police investigation? Have they come to the conclusions yet?
No, so that investigation's ongoing in relation to just the relevant authorisations to travel into Queensland, and obviously the other jurisdictions will be looking at their requirements as well. So we'll wait for that process to continue and we get a final outcome. Our priority and the priority of the police right now is, of course, that contact tracing, but those investigations will occur. And
what do you think of what this couple did? I mean, they left Melbourne when they shouldn't have. They came to Queensland when they shouldn't have. At the very best, it's irresponsible.
Look, I don't want to jump to conclusions until I know all of the facts as to whether they did have a travel declaration, whether there was an exemption to travel. I understand the husband was here with a new job, so we know that that is one of the grounds that people can travel due to work commitments, but I don't have enough detail. I'm not going to judge anyone's behaviour until I know all of the facts.
Are there any circumstances where somebody would be granted an exemption but then they wouldn't have to isolate for 2 weeks, so quarantine for 2 weeks?
Look, I'm not aware that there is any circumstances for that, but again, without knowing all of the facts around this particular case and whether they sought an exemption, but as we know, if people do get an exemption to travel, they are required to quarantine.
And Dr. Young, you're the one who grants these exemptions. Did you give this couple an exemption to come into Queensland and not undergo 2 weeks of quarantine?
No, they didn't come through the exemption process, so it's now up to police to investigate whether they came through any other process.
You mentioned, Dr. Young, that there were 17 close contacts.
Yes.
Who are those people apart from the family members?
So they're people who've been in close contact in restaurants, cafes, those sorts of areas. Yeah, so the only household contacts are the two parents, and they've tested negative at this stage, which is really reassuring.
You said they were at the end of the infection.
I believe so, yes.
Got here on Sunday.
Yeah.
Was there a greater risk that they could have spread it Sunday, Monday, Tuesday?
Less, I think. I think because we got serology done on them yesterday, and at that stage they were already IgG positive, which suggests that they've already recovered, so they've got neutralising antibodies. So that would suggest that they probably got infected at least 14 days earlier. So that's why I'm saying they're towards the end of their illness. Also their CT values, so their viral load is very, very low.
So therefore the risk to residents or any of those exposure sites is lower?
It's lower, yes.
Are you confident we can get on top of this and there won't be widespread community?
I believe so. Seeing the response from the Sunshine Coast has been absolutely magnificent. People have themselves come forward and said, I've been at this venue, what should I do? Which is the best result. So people are really taking on board where the venues are. We've already seen a ramp up in testing, which is just fantastic. So yes, I am confident that we can, with that continued cooperation from the people of the Sunshine Coast, I'm confident we can get on top of it.
Is that 400 people that have come forward?
Yes.
And they're all in Queensland?
No, we're working through with them because some of them are very casual contacts, so they'll just need a test, and if it's negative, they'll be fine. But it just shows, though, that people willingly, with that information that was put out by the media yesterday, thank you very much to all of you, that people have willingly come forward and responded, which is an excellent result.
400 who have come forward, who presumably been allergic to the 17.
The 17 are people we've found through our immediate contact tracing because they're very close contacts.
Any idea of where the couple picked up the virus in Victoria and how you're working with the
Victoria's working that through as we speak. We are waiting on genome sequencing results because that will help Victoria. I'm not sure that we'll be able to get genome sequences because the amount of virus is so low, as you'd expect towards the end of an illness.
Minister, you go.
And so, Dr. Young, that means that that we potentially may not find out what strain it was, and therefore, how infectious they were.
I don't need that information to work out how infectious they were. I'm getting that from other tests, from serology and from their viral loads. So I don't need to know whether it's the Kappa or which strain it is. That's more useful information for Victoria because then they'll be able to work out potentially how these people contracted it in Victoria.
How old was the husband? Sorry.
I don't have his age, sorry.
And the parents, are they her parents or
I'm not sure. I believe so, but...
Just while I got you there, the couple who came in from Qatar, who were yesterday reunited with their newborn at Royal Brisbane, they've asked for exemptions for family members to come up with dealing with the new one. What sort of view would you take?
Well, it depends where they are. I'd need to know where they're from. So whether they're from overseas or from New South...
Apply for an exemption like everybody else.
Yes, of course they can apply for an exemption.
They've
Yes.
also asked for some sort of help because they don't take the baby to Melbourne where they're from. It's going to be in
Yeah.
Melbourne until September.
Yeah, that's a normal process that we deal with regularly, so it would just go through that usual process to work out what's best for the baby, number one, of course, and then what else can be managed.
Just on that case, Dr. Young, before you go, one thing that's been said is that Queensland Health, essentially in response to the fact that this couple were fully vaccinated, that Queensland Health's sort of rigid processes around who must quarantine and under what circumstances haven't been nimble and responsive to this new factor, which is that we have people coming into the country who are fully vaccinated. What's your response to that, and are the processes changing now that people are vaccinated?
We're still reviewing the impact of vaccination. We know that just because you're vaccinated doesn't mean that you won't get infected. So we have seen in quarantine people who've been fully vaccinated who've then tested positive. So we still need to work out what the ongoing risk, if someone gets infected who's fully vaccinated, what is the risk for them to then pass that virus on. So there have been some very good studies done in the UK looking at that, and there are still cases, a reasonable number, where people have been fully vaccinated, got infected, and then passed on that infection to someone else who's not vaccinated. So we've just got to work out all of those. Now, a neonatal intensive care unit has a lot of very, very vulnerable babies and also their mothers and other visitors. So that's why we just, although it was heartbreaking for everyone involved, that's why we could not let that family go and visit their baby.
One more question on that case. Yesterday, the father involved said that he alleged that you had intervened in processes that were put in place by the hospital to allow them to cite the baby, namely via a screen, and the fact that the baby had in fact been isolated from others in the same unit. Did you intervene at all?
I wasn't involved in any conversations about that.
Minister, can I ask, do we know what mode of transport was used by the couple to cross into Queensland? Was it a car or a truck?
All I know is they drove from Victoria through New South Wales into Queensland. I don't know the size of the vehicle or the type of the vehicle, but I do know they came by road. I do want to just remind people who are in Queensland now, if you've been in New South Wales in recent times. So as Dr Young has said, these couple were more infectious when they were in Victoria and possibly while they were travelling through New South Wales. So New South Wales has put a number of exposure sites up on their website, and you can find those exposure sites on our Queensland site as well. So anyone who has travelled around New South Wales in the last couple of weeks, can I ask you to also just have a look at those exposure sites and make sure you haven't been to one of those sites. If you have, you need to follow the instructions as well.
There are huge traffic jams at Caloundra Hospital with lines of traffic and people and police having to step in. Is there any chance there might be a pop-up to this?
So we will be monitoring this throughout the day. I've spoken to the local members as well to say to them if they're observing very long lines, I'm happy to take feedback, but we will monitor this throughout the day. There will always be lines. I need to be very clear to everyone. No matter how many sites we set up, whenever we have a community case, we know that we'll have a lot of demand. So we do ask people to be patient, but it's also why we're asking people to register, because if you register, you'll get through the testing clinics far quicker. But we will monitor. If we need to look at additional sites, we will. But we've got the Caloundra drive-through site open 12 hours a day. They'll open all weekend, and we will look at other testing sites. But please remember, it's not the only site on the Sunshine Coast. So in addition to the public sites, Nambour, Gympie and Caloundra, there are private pathologists who are taking people in for testing where they don't need a referral at all, and a number of those pathologists will probably be open on the weekend as well. So please don't think that your public site is the only one to go to. There are many, many private pathologists on the Sunshine Coast that you can get a test for today.
And the girls who came from Melbourne and triggered the Ipswich outbreak last year, they were charged with given community service as their sentence. Do you think that the penalties are harsh enough to prevent people from sneaking into Queensland?
Police will, as we heard from the Deputy Commissioner yesterday, there is a range of penalties. And some of them, there is also criminal charges that can be laid. So, look, let's wait and find out what the facts are, and the police will make a decision as to whether there should be any consequences or any fines or anything else. Thank you.
Are we getting this right now?
I believe so, yes. They've said that's okay.